Have you ever had moments where your memory suddenly slips, or you feel unusually disoriented or confused? Maybe you've noticed sudden changes in mood, trouble concentrating, or difficulty with simple tasks that used to come naturally. While it's easy to brush these symptoms off as stress or fatigue, they might be warning signs of something far more serious. In this video, we're diving deep into the early signs of brain damage you should never ignore. Understanding these symptoms could be the key to detecting a serious problem before it progresses. The human brain is our most powerful organ, responsible for everything we do from thinking and feeling to movement and memory. When something starts to go wrong in the brain, the effects can show up in subtle but alarming ways. Brain damage doesn't always happen from a major event like a stroke or injury. Sometimes it starts gradually and silently, affecting your everyday life before you even realize it. That's why knowing what to look out for is so important. In the early stages, brain damage may show itself in ways you wouldn't expect. Frequent headaches, unexplained dizziness, sudden memory lapses, or difficulty speaking clearly can all be red flags. You might notice that someone close to you seems more forgetful than usual, starts behaving differently, or struggles with balance and coordination. These are not signs to overlook or explain away as normal aging or exhaustion. They are the brain's way of signaling that something is not right. This video will help you understand these early warning signs so you can protect yourself and your loved ones. We'll break down what to watch for, why these symptoms happen, and when to seek medical help. Early detection can be life-changing. With the right knowledge and timely action, it's possible to slow down or even reverse some of the damage, depending on the cause. So, if you care about your brain health or the well-being of someone you love, stay with us. The signs might be subtle, but the consequences of ignoring them could be severe. Let us explore the early signs of brain damage you should never ignore and learn how to take control before it's too late. Make sure you watch until the end. It might just save a life. Sudden memory loss or confusion. Imagine waking up and suddenly forgetting where you placed your keys. Or standing in the middle of a familiar room feeling lost and disoriented. These moments might be brushed off as forgetfulness or stress. But when memory lapses and confusion happen suddenly or more frequently, they could be warning signs of something more serious early, signs of brain damage. The brain, our most complex and delicate organ, communicates every dysfunction in subtle but important ways. And sudden memory loss or confusion is one such crucial signal. Memory loss is not just about forgetting a name or missing an appointment. It's about gaps in your mind where entire conversations, events, or actions seem to vanish. When these lapses begin to happen without any clear trigger, they may suggest the brain is struggling to process or retain information. Confusion, on the other hand, goes beyond mental fog. It can look like difficulty understanding time, place, or even who you are talking to. You might start mixing up people's identities. Forget what you were doing halfway through a task, or feel detached from reality. These experiences can be frightening and disorienting, both for the person going through them and for loved ones who notice something is not quite right. The causes of sudden memory loss and confusion are varied, ranging from head trauma and stroke to infections, brain inflammation, or exposure to toxins. In some cases, conditions like Alzheimer's or other forms of dementia may begin this way, long before they become severe. But not all causes are degenerative. Sometimes a temporary imbalance in blood sugar, a medication reaction, or even extreme dehydration can cause acute brain dysfunction. This is why it's so important not to ignore these signs, especially if they come on suddenly or get worse over time. When the brain's ability to function is compromised, even briefly, it sends clear distress signals. And confusion or forgetfulness is often at the top of the list. What may seem like a small mental glitch could actually be the brain's desperate cry for help. Acting quickly can make a difference, especially if the issue is reversible with prompt treatment. For example, early intervention after a stroke can prevent permanent damage. And correcting vitamin deficiencies or medication side effects can restore mental clarity. It's important to understand your own baseline mental performance. If you're normally sharp and organized but suddenly start forgetting routine tasks, losing track of time, or feeling mentally foggy, it's worth taking seriously. A change in behavior or thought pattern should never be brushed aside, no matter how minor it may appear at first. Talk to a healthcare professional, get evaluated, and explore possible causes. In some cases, brain scans or blood tests may uncover a hidden issue that can be managed or treated. Ultimately, our brains are the command centers of our bodies, and any disruption in their function should be addressed with urgency and care. Sudden memory loss or confusion, isn't just an inconvenience, it may be one of the earliest clues that your brain is in trouble. Paying attention to these signals and responding early can be the key to protecting your health, your independence, and your future. Frequent headaches or dizziness. Frequent headaches or bouts of dizziness might seem like minor inconveniences that can be brushed off with a glass of water or a short nap. But when they occur repeatedly without an obvious cause, they may be early indicators of something far more serious: potential brain damage. While it's easy to dismiss these symptoms as the result of stress, dehydration, or lack of sleep, they should not be taken lightly if they persist or grow in intensity. And even subtle disturbances in its function can manifest through recurring physical discomfort. Headaches are among the most common neurological complaints worldwide. However, the type, location, and frequency of these headaches can sometimes signal deeper neurological issues. When the brain is injured or under threat, whether due to trauma, poor circulation, infections, or neurodegenerative conditions, it often sends out warning signs. Frequent headaches might be the result of abnormal pressure changes inside the skull, inflammation of brain tissues, or impaired oxygen flow. These symptoms may also be linked to the early stages of conditions, such as a brain tumor, aneurysm, or chronic traumatic encephalopathy, especially if they are accompanied by other changes in behavior, memory, or mood. Dizziness, on the other hand, can indicate disturbances in the brain's ability to regulate balance and spatial orientation. The cerebellum and inner ear work closely to keep us steady and upright. But damage to these areas can leave a person feeling lightheaded, unsteady, or even as though the world is spinning, a sensation known as vertigo. While occasional dizziness can be harmless, persistent episodes might suggest damage to the brainstem or vestibular system. It can also be a warning sign of mini-strokes or early-stage multiple sclerosis, where nerve function is gradually impaired. What makes these symptoms especially concerning is how easily they blend into everyday life. A busy schedule, poor diet, dehydration, or overexertion can all cause headaches or dizziness from time to time. But when these symptoms become a pattern, occurring more than a few times a week, or lasting longer than they used, it is time to take action. Ignoring them and relying on over-the-counter medication can mask an underlying condition and delay potentially life-saving treatment. Paying attention to these signals is essential. If your headaches are accompanied by vision changes, confusion, speech difficulties, or nausea, or if your dizziness is severe enough to cause falls or loss of consciousness, seek medical evaluation immediately. Early detection of brain damage can make a tremendous difference in treatment outcomes, preserving quality of life and preventing irreversible harm. The brain rarely shouts when something is wrong, it whispers. And frequent headaches or unexplained dizziness are some of those whispers. Listening closely, acting early, and consulting with a medical professional can be the key to stopping a silent problem before it becomes a major one. Your brain is your most vital organ. Don't wait until it's too late to take its warnings seriously. Slurred speech or difficulty speaking. Slurred speech or difficulty speaking can be one of the earliest and most alarming signs of brain damage, and it should never be ignored. While many people associate speech difficulties with temporary issues such as fatigue or anxiety, persistent problems with articulation or language can point to something much more serious happening within the brain. The way we speak is controlled by a complex network of brain regions, and any disruption to this system can result in changes in speech, clarity, fluency, and coherence. These changes may be subtle at first, but they can escalate quickly if the underlying cause is not addressed. When someone begins to slur their words, it may sound as if they are intoxicated or overly tired. However, if there is no clear reason for this sudden change, it is crucial to seek medical attention. Slurred speech, also known medically as dysarthria, can occur when the muscles used in speaking become weak or uncoordinated due to damage in specific areas of the brain. This damage might be the result of a stroke, traumatic brain injury, a growing tumor, or a degenerative neurological condition such as multiple sclerosis or ALS. In other cases, the issue may stem from an interruption in the brain's ability to process and produce language, a condition known as aphasia. In many cases, slurred or impaired speech is accompanied by other warning signs. A person may have trouble finding the right words, constructing sentences, or understanding what others are saying. They may appear confused, respond inappropriately, or become easily frustrated when trying to communicate. These symptoms can be frightening both for the person experiencing them and for their loved ones. Unfortunately, the fear often leads people to dismiss the signs or hope they will resolve on their own. But when it comes to the brain, early intervention can mean the difference between recovery and long-term damage. One of the most important reasons to take slurred speech seriously is that it can be a sign of a stroke in progress. In such cases, time is of the essence. The faster a stroke is identified and treated, the greater the chance of minimizing permanent damage. Emergency services should be contacted immediately if slurred speech appears suddenly and is accompanied by facial drooping, weakness in one side of the body, or confusion. Even if the symptoms disappear after a short time, they could indicate a transient ischemic attack, which often precedes a more serious stroke. Chronic or progressive speech issues may also indicate slow-growing conditions like brain tumors or neurodegenerative diseases. These changes might come on gradually and be dismissed as normal aging or stress, but any noticeable decline in communication ability warrants a professional evaluation. Neurologists and speech-language pathologists can perform assessments and imaging tests to determine the root cause and recommend an appropriate course of treatment. In the end, our ability to speak and understand language is a powerful reflection of brain health. When that ability changes, it should not be taken lightly. Slurred speech is not just a symptom, it is a signal that the brain may be under duress. Recognizing and acting on this sign early could be life-saving or life-changing. Ensuring that any underlying issue is treated before it becomes irreversible. Changes in mood, behavior, or personality. It is easy to dismiss occasional changes in mood or behavior as reactions to stress, fatigue, or personal circumstances. But when such changes become frequent, unpredictable, or uncharacteristic, they may signal something more serious. One often overlooked warning sign of brain damage is a noticeable shift in mood, personality, or behavior that is persistent and not explained by life events. This subtle yet critical symptom can be a red flag pointing toward early neurological issues that require immediate attention. The brain is the command center of the body, regulating everything from physical movement to emotions and social behavior. When specific parts of the brain become damaged, even slightly, they can disrupt normal emotional balance and behavioral responses. For instance, damage to the frontal lobe, which is responsible for reasoning, decision-making, and emotional regulation, can result in sudden irritability, impulsivity, or a lack of empathy. A previously calm and rational individual might become aggressive or emotionally volatile without clear provocation. Changes in mood or personality might be the earliest indicators of brain damage caused by trauma, stroke, tumors, or neurodegenerative diseases such as Alzheimer's or Parkinson's. Someone who was once outgoing and enthusiastic might withdraw socially, showing little interest in family or hobbies. A usually cheerful person might become unusually anxious or depressed. These changes are not just personality quirks, but warning signs that something within the brain may not be functioning properly. Behavioral changes may also manifest as a decline in personal hygiene, increased risk-taking, paranoia, or sudden poor judgment. These symptoms can gradually worsen over time and often go unnoticed by the affected individual. In many cases, it is family members, friends, or coworkers who first observe the transformation. Loved ones may describe the person as acting like a stranger or being out of character. This disconnect between who a person was and how they are now behaving should not be ignored. Brain damage does not always follow a traumatic incident like a head injury. It can develop silently through repeated small strokes, chronic inflammation, or even long-term exposure to toxins. Mental health changes are often the first visible signs. That is why tracking behavioral patterns over time and seeking medical advice when something feels wrong is vital. Early diagnosis can make a significant difference, offering treatment options that may halt or slow the progression of damage. If someone you know starts behaving differently in a way that is concerning, trust your instincts. While it could be stress or a temporary emotional dip, It could also be a clue that something deeper is going on neurologically. The earlier such signs are recognized and addressed, the better the chances of managing or even reversing the underlying cause. Mental health and brain health are deeply connected, and behavioral changes should never be brushed aside. By paying close attention to these early warning signs, we may be able to catch brain damage at a stage where meaningful intervention is still possible. Loss of coordination or balance. Losing coordination or balance may seem like a common side effect of fatigue or stress, but it can also be one of the earliest and most telling signs of brain damage. The brain is the control center of the body, and even minor disruptions in its functioning can lead to noticeable changes in physical ability. When balance starts to fail or movements become clumsy without an obvious reason, it is often the body's way of signaling that something deeper is going wrong. The cerebellum, located at the back of the brain, is responsible for coordinating voluntary movements and maintaining balance. Any damage to this part of the brain can lead to difficulties in walking, standing upright, or even performing routine tasks that require motor control. A person might begin to stumble more often, drop things unintentionally, or feel dizzy without any clear cause. These symptoms can gradually intensify, making what was once simple and automatic now frustratingly difficult. In many cases, this decline in coordination is not sudden, but progressive. Someone might notice that their footsteps are less steady, or that they sway when trying to stand still. While such changes can also be associated with aging or conditions like vertigo, persistent and unexplained balance issues should never be ignored. They can point to more serious neurological conditions such as stroke, brain tumors, multiple sclerosis, or traumatic brain injury. In fact, some of the earliest indicators of a stroke can include the inability to control limbs or a noticeable loss of physical coordination. What makes loss of coordination particularly dangerous is that it can lead to further injury. Individuals suffering from balance issues are at higher risk of falling, which can result in broken bones or additional head trauma. These risks are even more concerning when the underlying cause remains undiagnosed. Furthermore, people may start avoiding activities they once enjoyed, leading to reduced physical fitness, isolation, and even depression. This symptom also impacts more than just the physical body. Cognitive functions like concentration, spatial awareness, and decision-making may also be impaired. If someone is unable to navigate a room or judge the position of their own body in space, it can create anxiety, confusion, and a loss of independence. This emotional toll can further cloud the issue, making it harder for both the individual and their loved ones to recognize that the root cause may lie within the brain. Early detection and medical evaluation are crucial. If loss of coordination is observed alongside other symptoms such as memory issues, slurred speech, or sudden behavioral changes, it becomes even more urgent to seek professional help. Brain scans, neurological exams, and balance tests can help identify the problem before it progresses to a more severe stage. In the end, the body speaks in whispers long before it starts to scream. A subtle loss of balance or a slight misstep might be more than just a passing clumsiness. It could be the brain calling out for attention. Listening early and responding swiftly can make all the difference in protecting both health and quality of life. Blurred vision or sensitivity to light. Blurred vision or sensitivity to light might seem like common issues that come and go, often brushed off as the result of fatigue, eye strain, or even a long day staring at screens. However, when these symptoms become persistent or appear suddenly without a clear cause, they may be signaling something far more serious. Among the many early indicators of brain damage, vision problems, especially blurred vision and light sensitivity, are often overlooked. Yet, they can be critical clues pointing to disturbances in the brain that require immediate attention. The human brain plays a vital role in processing visual information. Eyes capture images, but it is the brain that interprets them. When parts of the brain responsible for vision are damaged, the clarity and perception of the world around us can be drastically affected. Blurred vision may occur because of damage to the occipital lobe, which processes visual data, or due to pressure buildup in the brain that disrupts the optic nerves. If you suddenly find it hard to focus or experience a loss of sharpness in your vision, it might not be your glasses needing an upgrade. It could be your brain signaling distress. Sensitivity to light, also known as photophobia, is another alarming symptom that often accompanies neurological issues. This discomfort in bright environments can be more than just an annoyance. It might point toward inflammation, trauma, or infections affecting the brain. Conditions such as meningitis, concussions, or even tumors can produce this reaction. Eyes may be reacting to light, but the root of the sensitivity may lie deep within the brain structures. Another concerning aspect is how these visual disturbances can affect daily life. A person may find it difficult to drive, read, or even walk confidently. This disorientation can increase the risk of accidents and injuries. More importantly, it may reflect underlying brain trauma that, if untreated, can progress into more severe cognitive or physical impairments. Early detection and diagnosis are key, and symptoms such as blurred vision and photophobia should never be ignored. What makes these signs particularly dangerous is that they are often misattributed to less serious causes. Someone experiencing blurred vision might simply assume they are dehydrated or that it is a result of aging. Light sensitivity may be dismissed as a side effect of being tired or sitting in front of screens for too long. While these explanations can sometimes be true, persistent or worsening symptoms need to be taken seriously. They could be the first indicators of something as serious as a stroke, a brain infection, or chronic neurological deterioration. The brain is a complex and delicate organ, and its signals must be listened to carefully. Blurred vision and sensitivity to light might not cause immediate pain, but they serve as warning bells for something that could be silently progressing. If these symptoms appear suddenly, increase in severity, or are accompanied by headaches, confusion, or changes in behavior, it is essential to seek medical evaluation promptly. Ignoring the subtle messages your body sends can have serious consequences. Paying attention to your vision and how your brain processes light can help detect early signs of brain damage, potentially saving your quality of life or even your life itself. Trouble concentrating or processing information. Struggling to concentrate or having difficulty processing information may seem like everyday challenges, especially during times of stress or fatigue. However, when these issues persist or worsen over time, they could signal something far more serious. Trouble concentrating or processing information can be one of the early signs of brain damage that should never be overlooked. These cognitive changes might begin subtly, but gradually interfere with your ability to carry out tasks, make decisions, or maintain focus, hinting that the brain's functioning is under distress. The human brain is a complex organ responsible for managing countless activities, from motor skills and emotions to memory and reasoning. When any part of the brain is compromised due to trauma, illness, or degenerative disease, it can manifest as difficulties in concentration or slower mental processing. People experiencing this symptom often describe feeling mentally foggy, or as though their thoughts are running through quicksand. Tasks that once seemed simple may take significantly longer, and multitasking becomes nearly impossible. This is not just forgetfulness or tiredness, but a sign that something deeper could be at play. There are many potential causes behind this cognitive decline. Traumatic brain injuries, even mild concussions, can impair brain function. Neurological disorders such as Alzheimer's disease or other forms of dementia also start with subtle cognitive symptoms like memory lapses and trouble focusing. Conditions like multiple sclerosis, stroke, and brain tumors may also present with similar signs. Additionally, chronic conditions such as untreated high blood pressure or diabetes can contribute to cognitive issues over time by affecting the blood flow and oxygen supply to the brain. Sometimes these difficulties are mistakenly attributed to aging, stress, or lack of sleep. While these factors can certainly impact mental sharpness temporarily, true brain damage usually brings with it a pattern of persistent decline. When you or someone you care about begins to forget common words during conversations, struggles to follow storylines, or finds it increasingly hard to stay focused on tasks, it is crucial to pay attention. These are not signs to dismiss or chalk up to being overworked. They may be the brain's early cries for help. One of the major risks of ignoring such symptoms is that the underlying condition could progress without timely intervention. The earlier brain damage is identified, the better the chances of managing or even reversing its effects. Brain scans, cognitive tests, and neurological evaluations can help identify the root cause. Treatment depends on the underlying condition, but may include medication, cognitive therapy, lifestyle changes, or surgery in more severe cases. In today's fast-paced world, It is easy to brush off trouble concentrating as a minor inconvenience. Yet persistent issues with attention, memory, or processing should be treated as a serious medical concern. Recognizing and acting on these early signs can make a critical difference in maintaining long-term brain health. If you or someone close to you is dealing with unexplained mental fog or an inability to stay focused, do not wait. Seeking medical advice might be the first step in preventing more severe damage and preserving the precious capabilities of the brain. As we come to the end of this important discussion on the early signs of brain damage you should never ignore, remember that awareness is your first line of defense. The brain is the command center of your body, silently managing every thought, movement, emotion, and sense. When it starts to send out distress signals, even in subtle forms like persistent headaches, blurred vision, memory lapses, or sudden mood changes, it is trying to tell you something crucial. These signs are not random or harmless. They are warnings that deserve your full attention. Many people brush off these symptoms, thinking they are just tired, stressed, or simply aging. But delaying action can lead to irreversible consequences. The earlier brain-related issues are detected, the better the chances are for treatment and recovery. Listening to your body, monitoring unusual changes, and seeking professional advice can truly make a difference. It is not about being fearful. It is about being informed, proactive, and responsible with your health. If you or someone close to you has been experiencing any of the signs we talked about today, do not wait for things to worsen. Schedule a medical checkup, consult a neurologist if needed, and take steps to support your brain health through proper sleep, balanced nutrition, regular exercise, and stress management. Every small step counts when it comes to protecting the brain. We hope this video has helped you understand the seriousness behind these early symptoms. If it opened your eyes or made you think of someone who might benefit from this information, share it with them. Sometimes, a simple conversation or a shared video can be the turning point for someone to seek help in time. Thank you for watching and staying with us through this vital topic. Your health and well-being matter. Don't forget to like this video if you found it helpful. Subscribe to our channel for more health-focused content and hit the bell icon so you never miss an update. Drop a comment below if you have questions or want us to cover more brain-related topics in future videos. Until next time, stay informed, stay healthy, and always listen to what your body is trying to tell you.